has the pandemic taught you about leadership in public health?
Compassion, empathy, knowing that people were going through a lot, because if you lead in terms of pandemic and you were not empathetic, you were not compassionate, because you don't know what people were going through.
A lot of things that we're doing now could not be done. So before, we didn't believe in remote work. Now we all became experts at working remotely.
The 4 T's that we should have done at the level of community, we didn't do. A, we didn't test enough. B, we didn't treat enough. C, we lacked trust at the level of, I can't remember the 40 now, but everything, we failed to understand that this is a community-based disease.
Delay is dangerous. We have to avoid delays. We have to be decisive. We're going to make mistakes along the way, but we just have to make a decision, act fast, communicate, and be clear.
Being open to feedback so that we can all co-create that environment which was unique during the times of the pandemic. So women's resilience, and also the fact that whether we acknowledge it or not, people can work from anywhere.
We lack leadership in terms of research. We need to come together. It is a time for the world to come together.
We had to form support groups so that each of our team members who got infected will know. We actually got kits, we would deliver the kits to them, and then we had people call them in the morning and in the evenings just to check in with them. Even people who had to go into isolation centers, we kept making sure that their mental health was paramount to us.
To show trust and respect to those who know it. You can't know everything. And as a leader, I think some of our world leaders made mistakes.
We need to have some money for emergencies. And the economy, the money is the most important thing. And we need to build our institutions.
Give people space so that the workplace will not be a constraint, but it will respond to user need, employee needs.
Having a relationship with the powers that be and having their trust.
We cannot be spending 4% on health. Let us attain that minimum of 15%, which, the Abuja Declaration.
Bring as many people along that would add value. Taking with me one of my biggest nuggets, pulling others along and looking for how they can help, because we just don't know it all.
Supporting each other. The pandemic taught us how to do that much better. It taught us how to work better remotely, and it taught us also how to monitor productivity.